Well, welcome everybody. Thank you for joining us today to share a little bit about Trinity Health PACE. So we have with us here Travis Garrett. I'm going to let Travis introduce himself to our audience here and tell us a little bit about his story, his background, and what brings him into our area to do the exciting work that he's doing. And then we'll have some discussion and ask some questions and get your insight on some things. So Travis, if you would please introduce yourself for everybody.
Absolutely. So I'm Travis Garrett, and I'm the Executive Director at Trinity Health PACE of Pensacola. I've been with Trinity Health PACE since 2022, and we have brought to Pensacola the first and only PACE program in the Panhandle. But a little bit about me and how I got here. Traditionally, I'm a nurse. So my undergraduate degree is in registered nursing. And I did that for many years, working in places like ICU and ERs and neurological ICU, open heart recovery. And I was kind of unsure of what path I wanted my career to take. And at some point along the way, I started working for an organization called Health Choice of Florida, IASIS Healthcare. And that introduced me to this insurance and business side of healthcare. And I really felt I found my niche. So much so I dedicated after that, this is what I'll do with my career. And so I went back to school here at UWF, graduate school, and earned my master's in business administration. And I've worked for companies like Humana, managing Medicaid product, Care Plus, which is a subsidiary of Humana, managing Medicare and Medicare Advantage products. And so it was a natural progression. What I like about Trinity Health PACE is that not only is it the insurance plan and provides the insurance, but it's the managed care all in one. So I get to see both sides of medicine in one organization. Again, that natural progression, opening healthcare facilities, I was doing some of that in South Florida with some of these other organizations, and so it made sense.
Awesome. Well, it's always great to have an alumni here of UWF and the Lewis Baer Jr. College of Business. I'm sure they're very proud of you and the work that you're doing in the community, so go Argos. And so maybe let's dive a little bit into I think there's probably a good number of people out there who are hearing you use that term, particularly the PACE part. So maybe you could talk with us a little bit about, Trinity Health PACE and maybe sort of in general what the PACE model is, and then how does that work to support the health of seniors in our community?
Yeah, great question. So Trinity Health PACE, we're going to set our terms first. So let's define that because it can be confused with PACE Florida, right across the bay. But PACE for us stands for Program of All-Inclusive Care for the Elderly. And what we are is a 20,000 square foot center in Pensacola, but serving all of Escambia and Santa Rosa counties. And we're providing this model of care that is holistic, comprehensive, and coordinated. And the ways we do that are with an interdisciplinary team. So we have 11 disciplines, and I'll name a few that really stand out. From a primary care provider, social work, nursing, the therapies, physical therapy, occupational therapy, transportation staff, case management, dietitian as well. We take this team and we provide this coordinated care and develop care plans that are specific and unique for every participant, because no one person's care is the same. None of their needs are the same. And so we meet every single day, sometimes multiple times a day, and we're identifying the needs, measuring the gap, and filling it. And that's definitely a specialty of what we do. In addition to that, so creating the personalized care plans, we provide things like the primary care services in-house. Everything I just mentioned is in-house. We keep that on site. All disciplines are there. We provide support services as well. So that means transportation to and from things that may not be in our center, to and from physicians in the community, hospitals, to and from their home just to get to our center. We provide home care as well. So we'll send our staff to the home that's maybe outside of our normal business hours and on weekends to make sure they have the care they need as well.
That is wonderful. So having been to your facility, I can attest to the fact that it is a magnificent facility. And I've also shared with Travis that as I take one of my children off to school in the morning, I'm always crossing paths with the Trinity Health PACE bus that's coming picking up residents out where I live at, which is pretty far out, so all the way out in Pea Ridge and Santa Rosa. So obviously the service area that you all are operating in is expansive, but I know the transportation, I'm sure, is so appreciated by the families as one of the services you provide. So maybe we could expand a little bit and just talk, kind of beyond just medical care. You mentioned some other services that you provide, case management, et cetera. So I know that what you do does go far beyond just providing strict medical care. So maybe you could expand on that topic a little bit for us and just give us a little bit more well-rounded of a sense of just how broad the spread of services that you have.
Sure, so extremely broad, and PACE is critical for older adults with chronic conditions, particularly those that are also at-risk populations in our community that maybe don't have as easy of access to healthcare as others may have. And so beyond medical care, we do things like social, emotional, and then we meet the practical needs as well. So from a social component, our center has a daycare aspect, and so you can come in and socialize and make friends and be part of events. Sometimes just getting out of the house is a dramatic change in what may be a normal day of just sitting at home, right? And so being able to get out and about. So there's a social component. That emotional component. We have master social workers on site at all times. And we're able to provide things like counseling, emotional support, and I'll go beyond emotional too. We provide spiritual support, so we keep a chaplain on site, and we have spiritual care that we provide for our participants. And then the practical needs. Practical needs like just navigating healthcare, navigating the things that you need to do, both in a normal course of your life, but also with our participants, the ones that are aging in a different stage of life. Things get more complicated. As we all age, things change. Technology is changing, coordination of care is changing, models of care are changing. Just managing your insurance and appointments can be a huge hurdle for most. So we provide all that as well, and we'll do it in-house with our team. We'll coordinate all their care, supportive services. We're taking individuals to the grocery store. That's unheard of. Most managed care is not doing that. Insurance companies definitely are not doing that. We're bringing in-house other things like food pantries that we can have on our campus, so that both the community can use it as a resource, but also our participants as well.
And I know inside your facility you have a number of, you have your spaces obviously where you're delivering the care, so you have your therapeutic areas and your physicians, exam rooms, et cetera, but you have some other areas in the facility that are quite unique, and you mentioned spiritual care. I know you do have a chapel on site, I believe. Yep. But if maybe you could share a little bit, what are some other of the unique characteristics that build that social environment within your organization?
So some things that would be unique that you wouldn't find in a standard healthcare facility, or I'll rephrase it. Maybe that you wouldn't find, but what you wouldn't find altogether in one facility. And so we'll start with rec therapy. We have rec therapy that is throughout the building, not just in a day room setting. And so we have outdoor spaces to provide outdoor activities. We can do things in the clinic if need be. We can provide things like education and training in some components as well. Other unique things. Quiet spaces. Sometimes just having a place to take a nap and reflect, or a computer room. Laundry is another thing, and shower rooms. We have run into in the community that it is not always a guarantee to have your utilities on, to have your water accessible. And so we've made sure that need is met. And so if our participants need to come in and use shower utilities or do laundry, we've made sure that is there as well. So in addition to all the care from the clinic, laboratory services on site, to daycare and therapies in the gym and our dietary and kitchen services, we also keep all the administration on site. And so that means any help with your social work and case management, as I've mentioned, support and assistance with navigating the care, schedulers. So we take that out of the hands of the participant and family members to partner with them and hopefully ease the process. and we'll provide all that coordination. So we have schedulers dedicated to doing that. Medical records. If you need your medical records, it's there and accessible on site. We process the claims on site. Everything is done in one building.
That's wonderful. So you mentioned a service or a service line that maybe our audience isn't going to be quite as familiar with. Could you talk just for a brief moment about what is recreational therapy and why is that valuable to your patient population?
So recreational therapy is more than playing a game, right? We want it to be therapeutic. So we have a recreational therapist that when you enroll, we're performing an assessment, identifying these different areas. And so maybe you needed some assisted recreational therapy, maybe unassisted. Sometimes it's just a component of socialization and having events. So we put on events. We have games, of course, that is part of it. But like I'd mentioned before, everything's tailored. So as we're going through those assessments, we're identifying things that are specific to one individual and how can we bring it to a group. So there may be big group things. We try to incorporate a big one for us is movement therapies because we're always looking at ways we can decrease falls in our population. So we do gentle movement therapies in the mornings. We do Tai Chi in the building.
Okay.
Tai Chi has become a big hit with our population. So it's more than, again, playing a game. It's finding what interests you, how can we incorporate it into making you healthier as well, and being part of the activities and socialization that you get to experience.
Our population is growing, and in particular the areas of our population that are growing maybe more so in Pensacola compared to other areas of the country are the retirement age individuals that are moving into this area for a variety of reasons, whether it's military background or different factors. So, obviously this is the patients that are served by PACE, but how do you see the role of PACE evolving as our population continues to grow? Is this something that the community needs more of, and is it something that PACE also has to adapt a little bit to the scaling of the population?
Okay, so sure, the population's aging most definitely, and the need for PACE is only going to grow. I have not met a single individual that says, as they grow in age, as their healthcare needs and social needs and support needs become greater, I prefer just to go to a nursing home. That doesn't happen. Everybody wants to live as independently and as healthy as they can in their own home. That's what PACE programs do. We want to create an environment and create a community that allows us to do that.
You mentioned community a couple times, that you're building community. And so I would assume that a lot of your interactions are not just strictly with the patients themselves, but with the caregivers, the family, those sort of individuals that wrap around and support your patients. So could you talk a little bit about how you are working with those that are sort of in that immediate sphere of your patients to make their lives easier also as you care for their loved ones?
Yeah, so with our population, we typically find that there's a caregiver involved that's providing all of that care. So they're scheduling the appointments, they're taking to and from appointments, they're managing every component of their health care. We want to come in and take over those things where we can, but we're also looking for a partnership. PACE programs are only as strong as the community and the caregivers that we have that we're working with. So we always say we're creating this partnership. We want to alleviate and provide respite at any moment that we can. But sometimes we can only be as successful as the support and how we can partner with that caregiver. In some examples, dementia and dementia-related diseases can be very difficult to manage. We're showing successes of managing those and still keeping them safe and in the home, in their community, but it's with the support of caregivers. We need somebody that can call us in the middle of the night and tell us, something's happening or something's going on, because we are available 24 hours a day, 7 days a week to our population.
So I think that must bring a great sense of comfort to those individuals. And I will
Absolutely.
share, I was at a grand opening ceremony at your facility and did get to interact with some of the families of the patients that were present. And they were just so thankful for the work that your team was doing. And I think at least several times we heard, that they couldn't do this without you. And so I think that speaks to that sense of community that you're building. All right, switching gears a little bit. So next generation of healthcare, we often think about, we have groups of students that are making their way into healthcare and expressing interest in different facets of it. So how would a future healthcare or a student at a university, say at this university, UWF, or Pensacola State or any other, how would they learn about PACE? How would they maybe get involved, volunteer, or make PACE maybe part of their educational journey?
Yeah, so a few things we want to do. Again, partnerships. Partnering with the University of West Florida, we've had these conversations and bringing in some of those clinical rotations for whether it be nursing or therapy teams, dietary as well, if that's something you're offering here. We want to bring in because what we believe is PACE is a unique training ground. You're exposed to things that you were just not exposed to in other environments. I'd mentioned I've worked that continuum of healthcare from the clinical side all the way to this other business and insurance component sometimes in managed care, but not all managed care programs managed care like PACE does. We're truly all inclusive, and so having access to a training ground that has an interdisciplinary team that coordinates care. You don't have a single individual on the team that is directing care alone. And so what the physical therapist recommends is only one perspective. And so we have a perspective, we'll say, from even the driver of our transport team, or a personal care worker that is able to provide even further insight to the physical therapist and help us to really guide and direct that very unique care. And so you see this teamwork and this collaboration between disciplines that sometimes goes unseen, and it can be hidden. Not that it's not happening in other places, I just don't believe it's as open and out there and a part of our standard operating procedure, how we coordinate care and how we develop care plans. So they could get involved in those ways, through a clinical rotation and programs with the partnership at UWF. Visitors and volunteering, though, those are definitely opportunities. We can call our center, call us. I have somebody on the phones at all times. And we want to see how can we provide volunteer opportunities in our building. And I'll tell you, with our population, sometimes it's just having an individual that will come in and have a conversation with one of our participants, just somebody to talk to. And that's a great way to volunteer. If you want to be more hands-on volunteering, we'll put you to work too. We can find things to be hands-on with, some form of activity in the building. We do field trips. Volunteering and field trips would be an amazing thing and such a support. An example of that is we have taken individuals to the Navy base to watch the Blue Angels practice and tour the museum. But what comes with that is our wheelchairs and walkers and things like that people need support and assistance. And so volunteers would be wonderful in those capacities to help aid somebody by pushing a wheelchair even. And again, conversation throughout the day, I think. The senior population thrives in community and communication and just having conversations. Yeah.
So I will say that I think it is very unique to have that many different disciplines underneath what is, it's a 20,000 square foot facility, but compared to what we normally walk into in healthcare, it still feels a little bit more of an intimate environment, and having that number of clinicians and folks that are there. In education, we talk about that as in a professional education. We actually prize it, but it is sort of unique to your facility that it's almost purpose-built to be an incubator of that, what we consider best educational practice. So I would say I think this would be a great experience for students, and aspiring to work with maybe older adults in the future. I agree, just getting that conversational familiarity and just being a source of support, I think, is a great starting point. So hopefully we can encourage some students through this video to reach out and explore some opportunities there. I think that field trip obviously sounds amazing. Who doesn't like the Blue Angels? I mean, come on. So outside of students, for sort of for community members that are watching this video and get inspired, what could they do to potentially support the work that you're doing, or just to help spread the word about the availability of this program?
So to help us, again, we talked about volunteering, but being an advocate for PACE, and being an advocate could look like many things. Come to our events and support us. You're going to see us in the community. Stop by the booth, even if you know who we are and what we are and everything we do. Stop by the booth and talk to us. Talk to your friends and family. Talk to your community. Talk to your coworkers. We can advocate through these means. Even beyond that, maybe look at your needs and your family's needs. Because truly, a great first step would be to call us and see if the person you're taking care of is eligible for our program. And what I'll say about that eligibility is often our population's on Medicare and Medicaid already, and everything we provide is at no cost to anybody. And so that's huge. So they could be part of our program in that way, and that's a great first step, just to call us.
Awesome. Just kind of getting a sense, I know you mentioned this is the first PACE program in the Florida Panhandle. Could you just give us sort of a sense of how many PACE programs there might be sort of in Florida, and then maybe what are some states that have really kind of invested and are leveraging this type of program heavily?
So in Florida, I believe there are 7 open PACE centers, with more coming. We're the first one and only one in the Panhandle, but I believe the next closest one might be Jacksonville. So really the entire north side of Florida. Trinity Health PACE as an organization, we have 20 PACE centers in 11 states across the nation. They are rapidly growing. States are interested in PACE and want to see how they could bring that model to their states as well. Florida, I always say, is kind of on the forefront of healthcare sometimes, and especially in South Florida. That's where most of these PACE programs are, in South Florida. Other states like Georgia had just opened up the market, and they're interested in bringing in PACE programs as well.
So another question I think that comes up oftentimes is more on the pragmatic side from people when they're looking at this. I mean, you are, you have an insurance component to the work that you do, and most of the time people hear changing insurance, and their concern is I'm not going to get to see my doctor anymore. And we know that there's a lot of ways around that in areas, but maybe you could talk to our audience here and just kind of let them know how you navigate those situations with your patients.
Absolutely. So that is a concern in the population. Everybody wants to be able to keep their physician. They want to be able to keep the services that they currently have through the means they're already using it. But the PACE model is best when we can be a part of it. And so what I'll say to that is, even though we have a primary physician in-house and we want to provide your primary care, we do have arrangements and agreements that we can work out with other physicians. And so I do it all the time where we have a physician that may be in the community that we haven't spoke to yet, but one of our participants is using them. We're going to let them continue using them. And so I work out an agreement with them to make sure that's able to happen. Services are the same. If you have a company that's providing something for you, we want to make the continuity of care as seamless as possible. So we don't want to take away and then add back. We want to see how do we work with them. And so what I'll say for Trinity Health of Pensacola is that if you have a physician you really want to keep, we'll talk about that in the enrollment process, and we'll see how can we coordinate with that physician so you can keep them, because we most definitely will. And then the enrollment process can look scary. There is a lot of language when you're signing up for something new in healthcare that must be read and understood. We will assign an enrollment specialist that will go step by step through the entire process with them. And so they're not doing it alone. They're doing it with us. We're working it with them as well. Caregivers are involved in that process as well. And so, we will make a list of every physician you'd like to keep and see, and what you feel your needs are. We're going to, upon enrollment, talk about goals, what your goals are in healthcare, and where you'd like to see it go. And so we'll make sure every one of those needs are addressed.
Wonderful. Yeah. So before I ask you one last practical question, I will say that as you sort of have narrated through the discussions up to this point, you have presented opportunity to a lot of challenges that I see in our community, and,
Yeah.
and my perspective is different because I collect a lot of data on the community, and then we analyze it. But transportation needs, understanding enrollment processes. I mean, those are things that are really pervasive challenges that individuals face, and for a variety of reasons. It could be, transportation isn't possible because their caregivers are busy and they have gotten to a point where they can't drive themselves. Sometimes it's a financial barrier they can't afford, but nonetheless, transportation is a large barrier, and I think we've seen, especially with the some of the changes recently, that the enrollment processes are becoming more and more of a challenge for individuals. So it seems like you have services built in or baked into sort of the DNA of your organization that can help individuals support these needs. So I think that's just absolutely wonderful. So last practical question for you. So what makes one eligible for being part of a PACE program? Because I know that there's some criteria, so I think that would be good for our audience to hear a little bit about what those criteria are.
No, it's a great question, and luckily it's simple too. And so we're looking at a few things: 55 and older. So you've got to qualify by age. We do serve the senior population, so 55 years or older. There has to be an identified skilled need. And in the state of Florida, that comes through an assessment through the Department of Elder Affairs, which we will coordinate and organize. We'll make sure it happens. And they'll do an assessment that says they've made a determination that you need a skilled nursing level of care that PACE can provide. Beyond that, there is an income component. We do serve the population that is low income. And then the last step is we'll do an assessment and we'll come out, and we want to make sure that the care you need is something we can provide safely in the community. So there's a safety component. Once those things are done, you qualify for enrollment.
Wonderful. Yeah. So I want to make sure that we've covered everything that you wanted to share with the community. So are there any other thoughts or information you would like to make sure that we cover today?
Yeah, so PACE programs, again, we want to be part of the community. We don't want to be this healthcare facility that's in the corner of town that nobody knows about. So you're going to see us in the community. We want to be involved. We're going beyond just enrolling individuals. But one thing I would want people to know, again, that we had mentioned earlier, is the advocacy. We need help doing that. We need partnerships with our physicians locally, with our hospitals locally as well. And we want to ensure that happens not just for the community, but for our participants, because the more people we partner with, it increases the access every one of our participants have. We give them more and more options. And so we're doing that every day. And fortunate, so far, we have a broad network and community of groups that we work with locally. And so it's been fantastic to work locally in Pensacola. And then the last thing is, if you are unsure, give us a call. Like I said, we have individuals that are experts in this area, in the enrollment process of what it looks like. We're going to walk through it with you. We're going to help you figure it out. Even if you don't believe you're qualified, let us help you with it, and we'll help make that determination for you.
Awesome.
Yeah.
So I will also add that Travis and the group at Trinity Health PACE are just warm and friendly and welcoming. And so if they do have events on site, I would encourage you, if this is something that you're just even curious about, support their events, go see the facility. It is truly a hidden gem in the community, but it needs to get out there a little bit more. It's a beautiful facility, and to see their fleet of Trinity Health PACE buses that are going out and picking up people all over our area and bringing them to much needed services. I think it's just absolutely wonderful. And they have an amazing kitchen on site. Just so coming from somebody who's very interested in culinary and cooking, the kitchen is absolutely top notch. They did a knockout job with that. Well, I want to thank Travis for joining us today, sharing with us about this new program that is opening up in our area. For our student audience that's listening, I hope you heard a couple things from our guest. One, that there's opportunities there to work with his team to sort of expand your educational horizons. But the other thing I think that at the very beginning of Travis's journey that he shared with us was a little bit of that narrative about follow your passions, which we talk about quite a bit. Starting off with nursing and then moving towards more of the business side, getting an MBA. So those are the journeys that we love to hear about from former UWF Argos. And those are the things that we would want you to be inspired with too, as our guest has shared his story, is to follow that passion, find your path. Don't be afraid of change. And you'll find your way to what I believe for you is a very fulfilling position and very fulfilling career, and that's what we want our students to aspire towards. And for the members of the community that are hearing this again, hopefully this has raised your awareness of what Travis and his team are doing and what a PACE program is, and the program at Trinity Health PACE, and you'll help them spread the message about the availability of this program throughout our community. So, Travis, thank you so much for joining us today. It's been a pleasure.
Thank you for having me. It was wonderful.
And just one last note on the video, there will be a link at the bottom of this, so if you're curious and you just got to know right now, scroll down a little bit, click on that link, and it'll take you right to Trinity Health PACE's organization. You can learn more about their facility, their programs, etc. on that link. And so for those of you who are curious, go ahead and click that link and explore a little bit further.